We are here today at Symbios Medical, specifically Symbios Fit. I am here today with Wade Welsh. Good to see you.
Good to see you.
Miami man, that's what we were talking
Absolutely.
about. I'm really interested in functional medicine, number one, and the Symbios kind of integrated method, number two, and where specifically physical therapy fits in to the philosophy of the organization.
Absolutely. So the whole goal is when you go in and see Dr. Luther or any of the providers at Symbios, you go in with an ailment, they're going to refer you to me. We're going to do a full assessment, check every thing that might be related to the kind of issues or the kind of problems that you're having, and then you come to me for a while, we get you better. You get to the point where you can do the things that you want to do, whether it's picking up your grandkids or playing golf or whatever the case may be. And then hopefully we get you over to Symbios Fit with Steve, and he takes you up to that next level.
So talk to me a little bit about physical therapy. I don't know if there are misconceptions about it, but I've always wondered, at what point do I know if I need to come to a physical therapist? What's an injury? We talked about this a little bit. What's just sore? Balance for me as I get older.
Right, definitely. So we see a lot of balance patients, but with the injury, if it's not 50% better in 2 weeks, then your body's not really taking care of it the way it should. So then it's time to come get it checked out.
So what can I expect from physical therapy? I mean, what are the goals and objectives most of the time? Is it movement? Is it restoration of health?
Well, it really depends on the person.
Okay.
So some people come in because they've had several falls in the last year and they need help preventing another fall. Other people come in because they have back pain, specifically when they're swinging the golf club.
Back pain, never thought about that.
Right,
Yeah.
So it really depends on the person, their goals, and what they're currently having problems with.
Is it possible to go in to Symbios, have a physical or just have a treatment and ask for a referral or ask to come and see you to just
Absolutely.
because I would love to have, and I'm sure many of us would, just to have sort of a baseline assessment from a
Absolutely.
physical therapist. You seem to be weak here or here.
Right, so yeah, your first visit is one-on-one with me. So we sit, we talk, figure out what is going on with you as the individual, and then we come up with a program based off of that.
Additionally, can you share with me if I say my knees hurt, my shoulders hurt, my back hurts, my neck hurts, can you say some of this is normal? Can you kind of
Absolutely.
reassure me?
Definitely. A lot of these problems are normal, but the pain is not normal.
Okay.
So if we can figure out a way to correct the pain, correct the impairment, so that way you can get back to the things you want to do, that's what we're going to focus on.
So what I really hear you say, and this is something that I think I've learned about Symbios more than anything, is it's very much holistic, it's very much an integrated approach, and you have professionals in a lot of diverse fields
Right.
that can really work together. You said you are
Definitely.
referring and you are talking back and forth.
Right. It's definitely a collaborative effort. So if one of the providers, refers somebody to us, and I see something that isn't quite par for the par for the course, or maybe there's some more imaging or something like that needs to be done, I just walk right down the hallway and
my
talk to the
gosh.
individual provider, and it's so much better for the patient. They're getting higher quality care just because of that collaborative effort.
And it's funny that you say that, because I can imagine as a balanced patient, if you do notice something that you seem to be doing what you're supposed to be doing, and we're not making a great improvement, maybe we need to go to step B.
Right, exactly. Something else needs to be done.
How do you help prescribe, for lack of a better word, when we do come to get fit, or some of the other things? Do you guys all offer, have team meetings, I guess is really what I'm asking.
Yeah, we do, but also we have just, like I said, going down the hall, talking to the individual.
We go down the hall and talk.
Yeah,
we don't need team meetings.
It
Exactly.
is, it's great. Or I'll stop by over here and see Steve and talk to him, one-on-one about a certain patient. So yeah, it's always a collaborative effort, and it's always just back and forth communication to help the patient the best.
Oh, I can't. I've got such a list of personal things I want to ask. I can't stand it. It's
Let's
great
start.
I know it's great to talk to you, and I really appreciate it. Stay with us. A lot more to come.